So I think there's really three areas where we need to continue to invest in order to create a more modern and sustainable healthcare system. The first would be investment in what we're calling a health information exchange. So we know that within the acute care sector, the community sector, organizations are not going to be getting onto a single system. And so what we need to do is find a way to connect all of our disparate systems. So with a health information exchange, it provides really an underlying platform to connect systems together so that information can be flowing bi-directionally. And so in Ontario, we're working on something called the Ontario eHub project. And that's where we're starting with connecting the acute care with long-term care, and then we'll be expanding it from there. The other big area that we see is around population health. So we know that there is an abundance of data and information available, but we need to actually take that information, better understand our populations, and manage who we serve around us in the community. And I would be remiss at a conference like this to not talk about our underlying health infrastructure. So we need to continue to invest in our backbone, which is network, cybersecurity, et cetera, in order to move things forward. So obviously, virtual care, remote patient monitoring is here to stay, and there are so many different clinical pathways that we can be applying that. We talked in our session today about how do we actually deliver care for our patients closer to home. So doing so virtually is one way that we can do that, and it keeps our patients safe around their caregivers in their home environment. I'm really personally excited about an area called mHealth, and so this is how do we provide our patients with more apps on their phone so that they can connect in with their care teams, receive information, track how they're doing. And you heard a lot about today gamifying that experience to really incent them to participate more proactively in their care. I would say the third area, again, artificial intelligence. When we talk about how do we do work to help our workforce, where can we drive efficiencies? So there's a lot of exciting work happening around AI, virtual assistants. How do we kind of automate a lot of the back-end processes, even on the corporate services side? So those would be three areas that I'm certainly very excited about. Sure. So I think like a lot of people in healthcare, we come from different avenues and routes. And so I have a business background, and I started in a traditional way working in the States in investment banking and strategy, but I didn't find that work fulfilling. And so I went back to school, and I used that as an opportunity to really do a pivot point. And that allowed me to enter healthcare, first as a consultant, and then I found my way working for both the acute and community sector. So really encouraging those individuals that have a passion for healthcare, that want to find meaning in their work, to really think about maybe starting in a different spot within the healthcare system and trying to navigate. I would say advice that I have for new leaders that are interested in healthcare is start to understand the digital health landscape. Really put yourself out there, attend conferences such as this, meet people, understand what's happening. And I think for anybody that's entering healthcare, whether it be digital or another capacity, really focus on why you're here, and it's for our patients, and really putting the patients at the center of the work that we do. So this is my second year attending, and while we're early into the conference, it's a fantastic opportunity to connect with peers really across a number of different sectors. It also brings together an amazing mix of both government entities as well as vendors, plus our public sector employees together. So it's local as well, so that's an added bonus. And the actual track and curriculum that's been put together is very much focused on what people are talking about. So that's why I continue to come back.